Hello friends, how are you doing? This is Dr.Indra Cidambi from the United States of America. I'm a psychiatrist. எல்லாரும் எப்படி இருக்கீங்க? How are you? I'm coming up with the next episode. Let's see, before we jump into the topic, into the video today, I would like for you to subscribe and don't forget to press on the bell button. All right? So you'll be informed when I post a new video. All right, I hope you have already enjoyed the alcohol use disorder, 2 videos from that, So I was asked by some of you viewers that I should be talking more about what is addiction? What is addiction and the brain? What happens when you get addicted to substances? And what is detox? What is withdrawal? What is, the prognosis of addiction, right? So, nandbargale, many people have been asking me to talk about addiction. Addiction enna? What is the addiction got to do with the brain? And so far, so let me dive right into this video explaining what happens when you use drugs and alcohol. So the most important thing is that any substances, let's take an example of opiates. Opiates is the pain medication, right? When someone is taking, pain medication, what happens? Chronic pain is setting the brain up for addiction. How? Why? Chronic pain irunduchina, romba naalukku pain irunduchina, it makes your brain addicted to substances. Yadanaala, what's going on? So chronic pain, what happens is when you are having a pain, it's just not the pain alone. There is a center called amygdala in the brain. That amygdala is the center which is associated with negative emotions. So negative emotions, enna madrina amygdala nu or idam irukku brain la, that will give you negative emotions. What does that negative emotion means? Anxiety, irritability, and also you're feeling angry, you're feeling restless, you're feeling depressed. All these negative emotions, illa vidhamana negative emotions are associated with the amygdala. So it's going to say pain is not good. So try anything to stop feeling the pain. So imagine now with the chronic pain, they're not feeling good, right? They come to the doctor and the doctor gives them opiate medication, pain pills. So what happens is now the patient is taking doctor prescribed, mind you, if a doctor kudutha marundu, opiates, they are taking it. So what happens? The brain doesn't discriminate whether it's coming from the doctor. Doctor kuduthirukanga, I should not get addicted and solla poradilla brain. The brain does not discriminate. The brain just takes what comes through and it's going to work on that. So when the pain medication for chronic pain has been given, this pain medication lets the dopamine surge in the brain. Surge in nariya dopamine kudukka arambikum. So the brain in general has endorphin. Endorphin anaka, it's the hormone that it produces to make the pleasure activities. But the problem is it's only in a miniature quantity, konchundu quantity il dhaan varudhu, endorphin, the naturally produced endorphin in the brain. But when you do opiates, there is a surge of dopamine. Opiates irukkalam, alcohol irukkalam, edhu venalam irukkalam, you're going to get ton load of dopamine. That's called a pleasure hormone. That's a neurotransmitter. So now what happens is this amygdala is going to have the negative emotions, right? So the doctor gave the prescription, a patient took the pain medication, their pain is getting better, and they are like, this is magic, because now they are no longer feeling anxiety, they are no longer feeling depressed, nor are they feeling that irritability. They are now calm. Ella feelings settle ayi oru mari calm ah irukku. They are now numbing themselves. They feel great. I don't want to feel anything. Exactly what a patient would tell you. I don't want to feel. That's number 1. When they get to that point, that means they want more and more and more of these pain pills to not feel anything and feel calm. It's not the pain anymore. And so that's how they develop tolerance. More medication is being taken, so they develop tolerance. When more more pain pills is being taken and the tolerance develops, the next thing that happens is when they stop taking medication, the doctor says to them, "I'll continuously கொடுக்க முடியாது. Now you're like running out of medication. You're taking more than what I prescribed. So you're not compliant. நீ நான் கொடுக்கறத விட ஜாஸ்தி எடுத்து சாப்பிட்டுட்டு இருக்க. உனக்கு நான் என்னால கொடுக்க முடியாது. இந்த பெயின் மெடிகேஷன் இத்தனை நாள் தான் தர முடியும்." They'll stop. When they abruptly cut it off, the brain is now saying, remember, the amygdala is going to say negative feeling. It's going to give you that anxiety. It's going to give you that irritability back. It's going to make you feel depressed and you're feeling cravings and you want this medication. By hook or crook, எப்படி என்னால் I have to get this medication so that I can feel calmer. நான் சந்தோஷமா இருக்கணும். So then they go find a way, either from the doctor, go to the pharmacist, go to our friends, buy it on the streets. They take all the risky behaviors to just fill that void. They want to feel good. So feel good, enna venal seiven to make me feel good. So that's how the addiction starts off, right? So now, if they don't find it, they're going to go through withdrawal. So what does that withdrawal means? What it means is that dopamine kuda, there are other things, like it's a chaos in the brain. It's a chaos. Like, I'm not getting enough dopamine. Do something. I'm not getting enough. So when I'm doing something, what is the brain going to do? It's going to tap on everybody. Hey, for example, if somebody is going to be in an emergency, someone is going to stop giving us something, we are going to tap on all kind of resources that we can because we want it, right? Adhe maridhan, brain wants it. So it's like going to tap on all kind of neurotransmitters there. Could be norepinephrine, adu fight or flight, adu anxiety kondu varum, the norepinephrine அந்த சிஸ்டம் ஸ்டார்ட் பண்ணி விட்டுருது. செரட்டோனின் சிஸ்டம் ஸ்டார்ட் பண்ணி விடுது. இன் ஜெனரல் செரட்டோனின் சிஸ்டம் இஸ் சம்திங் லைக் dopamine will give you pleasure in quick second and it drops too, but serotonin is a slow pleasure and it remains stable for a long time. So all these systems are like getting wrapped up now, wounded up. So they're all like ready, soldiers mari, they're all like standing there to fight it, to get back the equilibrium, to get that calmness. So now it's a chaos in the brain. With this, what happens is that person is starting to feel the withdrawal symptoms, which can be runny nose, teary eyes, like flu-like symptoms mari vandra avங்களுக்கு cold irukka mari feel பண்ணுவாங்க. Hot and cold feelings varum. Bethu kottu, it's sweatiness, clammy hands. Then they have stomach cramps, diarrhea, these guys are like constantly irritable, anxious. They're having, bad mood. So it's such a painful place to be in. So they don't feel good. It's terrible discomfort and they don't want to be in that place. They just want a relief. So the relief is to go back to using opiates. That's the easiest thing. That's why you see a lot of people who are addicted to pain pills are struggling to stop using pain pills. That's the bottom line. They don't want to feel the way they're feeling, and they know if they take the pain pills, they're going to feel phenomenal. That's the biggest problem. So we need to stop this cycle. It's a vicious cycle. Eppadinga the vicious cycle நம்ம நிறுத்துறது, they want to feel good. So in order to do that, we do detox. The good news is this: among all the substances, the detox for opiates is the best because we have a great substitute. Fantastic medication இருக்குங்க. அந்த மெடிகேஷனை கொடுத்தோம்னா ப்ராப்பரா டைட்ரேட் பண்ணி அவங்களுக்கு எவ்வளவு கொடுக்கணுமோ, எவ்வளோ பெயின் பில்ஸ் யூஸ் பண்ணாங்களோ இல்லை ஹெரோயின் யூஸ் பண்ணாங்களோ, அதை பொறுத்து if you are going to give them, depending upon whether they use heroin or fentanyl or any other kind of like morphine or tramadol, kratom, அந்த மாதிரி எந்த ட்ரக் யூஸ் பண்ணியிருக்காங்களோ அதை பொறுத்து if you are going to titrate up the medication, make them feel good and also give them clonidine. So இது ஒரு பிளட் ப்ரெஷர் மெடிக்கேஷன் கிளானிடின்றது, அதை வச்சு கொடுத்தோம்னா இந்த நாரெப்பினெஃப்ரினோட எஃபெக்ட் எல்லாம் எடுக்கும். அது கூட கொஞ்சம் ஆன்டி டிப்ரெசன்ஸ் எல்லாம் போட்டு ஒழுங்காக கொடுத்தோன்னு வைங்களேன். If you're going to titrate and if you're going to give supportive, soothing medication along with, to help with the serotonin neurotransmitter with an antidepressant medication, if as needed, we can win. We can make them, stop using opiates along with the cravings too. This will even help them with cravings. Buprenorphine medication, ரொம்ப beautiful, so that really helps. So as difficult as these withdrawal symptoms are, the treatment will make them feel so good. That's amazing. Now that they feel so good, the next step is that they need to engage in treatment. In order to engage in treatment, we need to give them therapy. We need to find out what are the things that they are suffering from. Most times, 80% of the time, they do have comorbidity, meaning chumma they're not doing drugs. They're doing drugs because they're self-medicating their mood symptoms like depression or anxiety or any of those things. We spoke about that in my previous videos. அதனால these guys are like, நமக்கு நல்லா இல்லை, அதனால நம்ம மருந்து எடுத்துக்கலாம் அப்படின்னு சொல்லிட்டு இந்த பெயின் மெடிக்கேஷன் எடுக்க ஆரம்பிப்பாங்க. So what you want to do is address those symptoms, the underlying psychiatric issues. And that way, we can win this war of addiction. So really, we need to teach these people how to face their cravings, and they need to understand cravings will remain for the rest of their lives. But the good news is this. If, for example, நான் right hand use பண்ணி எழுதுறேன், சரிங்களா? எனக்கு right handல if I'm going to get hurt, my brain will accommodate, and then it will like try to use my left hand to fulfill my activities. So adjustment happens. This is called neuroplasticity, right? When I use drugs, and now when I'm not using, I'm no longer getting enough dopamine. So my brain will start healing. It will come back to the normal endorphin level of pleasure hormone that normally the brain makes it. But it takes longer time. Longer time, now 1 to 2 years could aidunga. 1 to 2 years period of time, we need to be in treatment. So what kind of treatment can we do? The first step is detox. The second step is into rehab. Rehab is the place where they learn how to manage their addiction. The third step is the outpatient treatment. ஒரு டாக்டரோ ஒரு தெரபிஸ்டையோ பார்த்துட்டு மருந்து வாங்கிக்கணும் டாக்டர் கிட்ட இருந்து. The psychiatrist will prescribe medication and the therapist will be doing the talk therapy, and they will be bringing in the family issues. And, it's a family disease, So once you incorporate the whole family, we will see success. And so that is because of the neuroplasticity. Addiction is a learned behavior. And so we definitely can make the same brain undo, right? So adukku oru chinna example oda I'm going to close this video. நான் மெடிக்கல் ஸ்கூல் போனப்பங்க, in order to draw blood, எனக்கு அவ்வளோ கஷ்டப்பட்டு I have to learn how to find the vein. Right? Vein kandupidikkulla I had such a difficult time because in my medical school I had to get the training to get an IV, placed or to draw blood. Finding the vein is not that easy. But somebody who is doing IV drugs of use, never went to medical school, never had any formal training. அவங்களுக்கு ஒருத்தரும் ட்ரைனிங் கொடுக்கல. அவங்களே தன்னுடைய வெயினுக்குள்ள தன் கையாலேயே இன்ஜெக்ட் பண்ணிக்க முடியுதுன்னா அந்த அளவுக்கு இந்த பிரெயினால accommodate பண்ண முடியுது. If you can learn that, definitely, if you're watching this and you're addicted to something, your brain is smart enough. Your brain can undo what it has learned. So please try to believe in that strength. It's not willpower, but if you learn to control your emotions, if you can learn through therapy what to do, you will win this war against addiction. So doesn't matter which substance. I just took opiate as an example here because we spoke enough about the alcohol. So I thought, let me use opiate in this example. All right. Thank you so much for your time. Nanbargle, I'll come back with a better topic next time. Up until that time, thank you. Love you all. Keep subscribing. Keep sharing these videos. I need more support to reach people. And I did get feedback that speak more in English. அதனால நான் நிறைய இங்கிலீஷையும் யூஸ் பண்ணி தமிழையும் யூஸ் பண்ணி I'm like trying to talk to you all. Please feel free to inbox me, and I will be more than happy to be there for you guys. Thank you, and you have a great week ahead. This is Wednesday here. Good night for those who are watching me from India, those who are from the United States. Have a great day and a great week ahead. I will come back with a beautiful video next. Thank you.